still got that opportunity on that day. So if there is a case that comes to mind, everyone feel free to reach out, let us know, and we'll have our session next week too, and I'll be giving you one last chance to sign up. So with that, I'll turn it over to Jillian for our didactic today.
Okay, thanks very much. This is such a cool program, and it was really neat to get to walk through that case and get all these different perspectives. It's awesome. Okay, so I will share my screen to start, and then we'll come up here. Okay, so I will be talking today about specialty referrals. And specialty referrals can be kind of tricky and complex, and you have to know all the things. And so I just thought this was a good way to open it up. I like it. And I think being able to use like a little bit of humor and I don't know, just something unexpected can be a nice way to connect with clients and colleagues. All right, so I work at Quest Counseling, which is a counseling agency in Reno, Nevada, and we received a grant in 2018, I can't remember when it started now, for our neonatal abstinence prevention program. And it was definitely a need that we saw in our community, particularly around women who were using opiates and becoming pregnant unintentionally or even intentionally, being able to provide them with support around that process. We've since been able to expand the program to include other substances besides just opioids. Here in our community, we see meth as one of the drugs of choice that can be problematic. And while it doesn't cause neonatal abstinence syndrome per se, when a mother or a pregnant person is using any substance, really, it can have just adverse effects. And so being able to expand the program has been something that we're really excited about here at Quest. And this is the most up-to-date information that I could find as far as why it's important that we have this specialty program. And even though it says 1 in 5, I would really argue that it's likely more. We're really helping to encourage community members, particularly those who come into contact with pregnant or newly parenting mothers, to make sure that they're screening, because particularly after babies are born, the focus shifts so much from the mom. While she's pregnant, she's getting all of this care, and then afterwards she gives birth, and the focus of care really shifts to the baby, which is lovely and appropriate and fine. And I think it's going to be helpful for the whole family unit and then greater community if we can also continue to wrap that mom in support, including mental health support and substance use prevention and treatment as necessary. So these are some of our core services that we provide here at our program. Our program is an outpatient program, and we offer MAT services. We have on-site APRNs, peer support, and targeted case management. Our clinicians here at Quest are all trauma trained and do trauma-informed therapy, which can be a really important factor, especially when we're talking about substance use. Anecdotally, and probably the research supports this, I just can't cite it, trauma and substance use tend to dovetail. People don't usually, be like, I think I'll just, develop an addiction just because. There's usually some kind of trauma history that can be usefully and helpfully treated if we know what it is and if we can work with it in an appropriate way. We are able to offer in-person and or telehealth services because sometimes there's some good things about COVID and that's about it. So we are able to offer telehealth, which actually is has been a great benefit to a lot of the moms in our program, especially. Transportation tends to be a big barrier, as well as childcare. And so we're really seeing that telehealth for many of our moms has made it possible for them to receive weekly services in a way that maybe would have been at least more complex prior to telehealth being available. And then we also have a pregnant and parenting support group, which is also over telehealth right now, although I'm really excited for one day in whenever the future happens when we can do it in person, because then we can have food. And then our referral process. So my vision for this presentation is I'm going to talk to you about our referral process to kind of like give an insight into specialty referrals and what you might expect or what you might like look to see in the process of making a specialty referral. So I hope that that's helpful for you all. I'm happy to answer questions as we go, trying to also be mindful of time. So if you have a question, I guess you can feel free to chat in, or we can do it at the end. So the referral process is a tricky process, as we have found in the kind of inception of this program. We want people to know about our program and we want people to be able to access it. And we're still working on the streamlining process of referrals. So this is kind of what we have so far. What we found has worked the best is when the referring agency or provider contacts us directly with the client present. That has tended to get the best results so far. It's not always, it's just not always practical. And so if that doesn't happen, it's okay. We actually recently developed a referral form so that we can just better capture the information that's needed, especially if a woman calls and she's pregnant and currently using an illicit substance. There's a lot of important and pertinent information needed, particularly if she's interested in MAT services. And so the referral form will hopefully make it easier either for us to capture that information directly from the client who calls, or to get that information from the provider so that they know what they kind of need to gather to share with us. Let's see. So these, I won't read it to you or anything, but knowing about other programs in case our program is not the right program for them. As I mentioned, our program is outpatient services only. And so for some of our clients, their needs might be more intense than that. So inpatient might be required. Releases of information or memorandums of understanding have been really helpful, we have found. And we'll talk a little bit about that a little bit later. And so this is also like a little bit of insight for you all into, because I've also found that it's really helpful for the referring provider to kind of know what to expect, so they might be able to prepare the client. So this is what happens on our end once a client or a referring provider contacts us. We try and get the initial assessment scheduled within 48 hours if the client's pregnant and actively using. Our initial assessment is a 2-hour process. It's a complete biopsychosocial. With our partners at Renown, they do their own version of a biopsychosocial, and so they have begun faxing that over to us, included with a referral. And so we're able to not have to do that initial 2-hour assessment chunk, which for some clients is a barrier. And so that has been helpful for our side. And then we talked about this a little bit already, the importance of working with the client, not at the client. And that's like really one of our core values here in this program and this agency, is that we want to meet the client where they're at. We want to know what's going to be helpful for them and really empower them to be a participant in their treatment and not just kind of feel like things are happening to them and they don't have choice or agency. And that can be really important, particularly for women who have a history of substance use, trauma use, or trauma, and then are pregnant or newly parenting. It can kind of feel like things are out of your control pretty easily. And then also continued input and involvement from the referring agency. I think Colleen mentioned it earlier with Dr. Dalton, really having a team approach so that folks are on the same page and the client can feel cared for in that way. And then what happens next if it's a MAT services referral? And so this, we're still working on ironing out and smoothing it, making it as smooth a process as possible, because we want to make it easy for these clients when they're ready to be able to pull the trigger and get this support as soon as possible. And so this is kind of our current process right now for somebody who is either pregnant or newly parenting and who's interested in MAT services. So challenges related to referrals. Scheduling is by far the biggest one. It's been tricky to kind of balance the schedules of both the client and the agency. These clients are priority clients, and so we do make every effort that we can to get them in as soon as possible. We have clinicians who have eval slots that they hold specifically for this client population on a weekly basis, and we have multiple clinicians who do that. And so we're usually able to offer a client at least like 1 or 2 options within that 48-hour period from the time they contact us. And it depends on what their schedule is as well. So sometimes we can be a little bit flexible, and if they need that initial assessment but we can't get the 2-hour chunk, we can maybe do it in like 1-hour chunk and then another hour later in the week or whatever it is. We try to be flexible if we can, but scheduling tends to be a challenge. Lack of access to services. Obviously, clients who have a job, they might not have childcare, they might not have transportation, internet access. If we were going to do a telehealth session, obviously if they're coming in for MAT services, we will need to do a urine analysis, and so we can't do telehealth for those initial sessions. Depending on what stage of change the client is in, you guys are probably aware of this, but we really will try to capture that client if they're in that action stage of change, if they're calling us, or at least they're in contemplation, and we really do what we can to kind of like take that momentum and run with it. And what we have seen over the course of this program is that sometimes clients are in that contemplation, preparation, action stage, and then by the time it comes around to the actual assessment or the initial session, they don't show up. And we try and call them, and maybe they have gone back to using, or they have changed their mind about wanting to be sober or pursue harm reduction. And so that's that. As we discussed with the case presented today, there's not great access for services in rural areas. Pregnant and newly parenting women specifically who have substance use issues face a lot of stigma and fear, and also a fear of having to involve child protective services or maybe the legal system at all. And so really doing a lot of education for our providers and the clients that that's not what our goal is. We don't have to let CPS know unless there's like a specific issue, and it's not like a required part of our program. And there's high community need, which can impact accessibility. So these are some components of successful referrals. We kind of refer to it as a warm handoff. And so one thing that I have really found is so helpful is increasing clinical provider education, just making sure people are aware of the program, and making sure that they're like bought in, right? That they're like, oh yeah, I've heard about that program. It's a good program. They're gonna, provide you services that are helpful for you. They're not gonna push you to change before you're ready. And so really just making sure that folks in the community are aware of the program. So accurate, obviously, SBIRT assessments, and really encouraging folks to do multiples of these, particularly with pregnant and newly parenting women. Their moods can change rapidly, and some of that is hormonal, and some of that is sleep related, and some of that is because life is hard when you're pregnant, and some of it might be related to substance use, or some of it might, like there might be some attempted mitigation that person might have with substance use. And there's really no one way that a person with substance use presents. And so making sure that we're being diligent in doing these short screening assessments so that we can capture, the person who has a heroin addiction and is using intravenously, and maybe the person who has a mild alcohol use disorder and is unaware that, that they're in that category, and could just could benefit from a bit of education and support. And so making sure that the trusted providers are working with the client directly, non-judgmentally. Somebody has mentioned already motivational interviewing skills, like really meeting the client where they're at, listening to them, listening to what they want and are interested in. Being on a first name basis with a referrer has been hugely helpful for me. Like I really have, I think that has made such a difference to our program success and getting it out there in the community. So that's a good one. And then continuing to contact folks about how your program is doing. Making community connections. And so we talked a little bit about this in the case that we reviewed earlier, but the importance of just communication, coalitions. I will say game nights and sharing food and drink can be a really lovely way to connect with others in your community and talk about the work that you're doing. One of the best provider connections that I made at a bunco night. And so like getting, obviously now it's a little bit different. Don't say that I told you to go to a bunco night now. We have to get creative, but really kind of being open to a little bit of overlap between like personal and professional connections, I found has made a big impact in like finding what other services are available and making sure that people know about my program or our program here at Quest. So this is just a list of our program referral sources. It's specific to our program, but you know, kind of the way that I conceptualize referral sources is like trying to think of it as like a chain. Okay, if a woman finds out she's pregnant, like how does she find that out? And then what happens? And then what happens? And then what happens? And like then who might she see? And then who might she come into contact with? And you can see the ones that have MOU are the ones that we really like targeted to partner with, so that we already have like memorandums of understanding in place so that referrals can be as smooth as possible and we can share information back and forth really on the front end. Client linkages has been a really lovely way to promote our program and make sure that clients are getting the care that they need. There's so much that goes into it. And so making sure that once they're involved in our program that they are hooked up to whatever program might be out there to provide help and support to them to be successful. So special considerations for COVID, obviously like telehealth and in-person we talked about. We have a client community closet here at Quest. And so there's like diapers and wipes and like all kinds of good family stuff that's available. And so that helps our clients get their needs met as well. It's not just mental health and MAT services that they receive here. Childcare challenges of client and clinician. There's been a few times where I've been working from home. My kiddo has been home from daycare and she's kind of climbing up in the background and I'm like, well, and I found it can be, you know, not ideal, but sometimes a useful way to bond with the client. And then this is just, again, like I think a funny quote that I enjoy, and I feel like every single mom everywhere at some point has like noted the difficulty that is involved in being a mom, a parent. And so recognizing that and just being able to like validate and honor that. It's hard, but we can do it. And especially with support. I like the image of an ant because an ant, although this is singular, is part of like a community system. And that's it.
Wonderful. Thank you so much, Jillian. Great information that you shared with us here today. I know we're a little bit over time, so if you have to take off, we certainly understand, but want to hang out if anybody has any questions. If you do, please feel free to unmute yourselves or write into the chat box.
How do you bridge the gap between, you know, nobody else, when the patient thinks nobody else knows what I'm going through, you know, to, you know, oh, I'm not the only one.
Yeah, I think that's a super tricky one. And like validate. And you know, you might even share that statistic of like 1 in 5 people actually have like symptoms of perinatal mood and anxiety disorders. It's a really underdiagnosed thing. A lot of people try and kind of informally treat their mental health with substances, and so you're not alone in that. And there is like help and support for you. There's even a specific program that has been developed for you. So just kind of like validate and then slide in that psychoeducation and connection. And that's where it can be really helpful too, to be like, no, Jillian's cool. I've met her. Like, I can see that she is like invested in this program. Like, you know, it's different for a client when they can hear someone's first name and they can hear somebody they trust who's a professional they trust encourage them about this program or whatever program it is.
Melissa shares, at PSI, we have a motto, you're not alone, insert education numbers, etc. You are not to blame, and with help, you will be well.
That hits on all those things that Jillian just mentioned.
Yeah. Yeah. And, you know, you could even start with like recommending PSI, I'm blanking on it now, Postpartum Support International. And so there's some good website resources out there of like, okay, if you're not ready to call Jillian right now, like check out this website, like you kind of did as well, Dr. Dalton, with your client. Like you can start exploring and researching on your own. Oh my gosh. Wow, Dr. Camier. Yeah.
So yeah, for those of you who might not have seen it, Dr. Cameron shares through the chat box. One shocking statistic that I find helps normalize is that drug-induced deaths is the leading cause of death for women of reproductive age, more than all other causes. Dr. Band says 1 in 5 is too shocking to believe.
You know. Yeah.
All right. Any other questions, comments, thoughts for Jillian or the team? Colleen says support groups with similar issues such as pain management can be helpful.